Effective communication is important with our patients, not simply to convey the correct information, but to prevent harm and adverse events from occurring to our patients. Over the past few years, medication errors are increasing in frequency and cost throughout the United States. According to the Patient Journal of Safety, medication errors may now be the third leading cause of death in America. Just think about that for a second. The third leading cause of death is completely preventable. With effective communication techniques, we can literally absolve a leading cause of death. Imagine if we could do that with cancer or diabetes or hypertension. Through simple efforts and communication techniques, we can completely eradicate a leading cause of death in the United States. It's difficult to determine the exact number of deaths directly attributable to medical errors, but in 2013, the Journal of Patient Safety concluded that between 210,000 and 440,000 patients suffer some type of preventable harm that could lead to death. Again, these are not all directly attributable to communication errors, but they were all also not prevented by effective communication. Healthcare in and of itself, and by nature, is a complex enterprise with many specialties and disciplines working together in a stressful situation. Each discipline communicates a little differently. Myself, I'm a pharmacist. I talk to other peers and patients differently than some of my coworkers who are nurses or doctors. There needs to exist a collaborative communication between multidisciplines to make sure that the information is effectively conveyed to our patients. Individuals in the healthcare field are consistently rated amongst the top and most trusted professionals out of all jobs to the consumer. We have a duty, we have a responsibility to the patient to ensure that we are providing adequate and effective service. Our patients' lives are literally in our hands. It is our responsibility to do everything possible to make sure that we effectively communicate with our patients to decrease patient harm and any adverse events that could come therein. Now Nancy is going to talk a little bit about some of our key concepts for the rest of our presentation.